Seniors, beware. 9 popular medications that trigger rapid dementia. Every minute, another senior in America is diagnosed with dementia. Most people assume it's just part of aging. But here's the surprising truth. In many cases, certain medications may be speeding up memory loss more than age itself. For decades, these prescriptions have been considered routine, taken for sleep problems, allergies, pain, or even digestive issues. But new research is uncovering serious risks. Some of these drugs don't just cause drowsiness or mild confusion. They can actually shrink the very parts of the brain that control memory and learning. One major study showed that seniors taking a common class of medications had nearly a 50% higher risk of dementia within only 2 years. The hardest part is that most older adults don't know this connection exists. You may be taking one of these pills right now without realizing how it could affect your brain over time. And while these medications may seem harmless or even necessary, the long-term cost can be your independence, your clarity, and your ability to enjoy everyday life. That's why in today's video, I'll share the 9 most concerning medications linked to rapid memory decline. Some are so common you might find them in almost every household. Understanding them could be the first step to protecting your memory and your future. Now, let's start with number 9. Number 9. Diphenhydramine, better known as Benadryl. This is one of the most common pills in seniors' medicine cabinets. Many take it to help with sleep, to calm allergies, or to get through a stubborn cold. It's sold over the counter, inexpensive, and easy to find, so it feels safe. But for your brain, it may not be as harmless as it seems. Benadryl is part of a drug family called anticholinergics. These medicines block a natural brain chemical called acetylcholine. Think of acetylcholine as the messenger that keeps your memory sharp and your mind alert. As we grow older, our brains already have less of it. Blocking even more can put memory centers, like the hippocampus, under extra strain. Research has shown that seniors who use anticholinergic drugs regularly face a much higher risk of dementia. Some studies say nearly 50% higher compared with those who don't. That's a serious concern for anyone hoping to protect their memory and independence. The good news? Safer options exist. For allergies, medications like loratadine, sold as Claritin, are considered much gentler on the brain. For sleep, doctors often recommend other strategies or alternatives that don't interfere with memory. The key takeaway is this: just because a pill is over the counter doesn't mean it's safe for long-term use. Talk with your doctor before relying on diphenhydramine, and give your brain the protection it deserves. Number 8. Proton pump inhibitors, or PPIs. You may know them as Prilosec or Nexium, drugs often marketed as gentle and safe for long-term use. Many seniors take them for heartburn, acid reflux, or GERD, sometimes for years without a second thought. But what most people don't realize is how these pills can quietly rob the brain of key nutrients it depends on. Here's why. PPIs work by reducing stomach acid. That may bring relief, but stomach acid is also what helps your body absorb important vitamins and minerals. One of the most critical is vitamin B12, which protects memory, supports focus, and even stabilizes mood. Without enough B12, neurons, the brain's messengers, struggle to send signals properly. The result? Confusion, forgetfulness, and lapses that can look a lot like the early stages of dementia. And the concern doesn't stop there. A large study published in JAMA Neurology found that seniors who used PPIs regularly had a 44% higher risk of developing dementia compared to those who didn't. Researchers have also linked PPIs to lower magnesium and calcium levels, and even to the buildup of harmful proteins in the brain associated with Alzheimer's disease. The good news is that safer alternatives exist. If you're taking a PPI every day, talk with your doctor about whether you can gradually taper down. Options like famotidine, sold as Pepsid, are less likely to interfere with cognition. Even natural remedies, such as deglycyrrhizinated licorice, may help soothe the stomach without harming the brain. Remember, long-term heartburn relief should never come at the cost of your memory. Number 7. Bladder control medications, such as oxybutynin, sold under the brand name Ditropan. For many seniors, urinary incontinence or an overactive bladder is frustrating and embarrassing. Doctors often prescribe oxybutynin as a quick fix, and on the surface it seems practical. You take the pill, and the symptoms improve. But what's not often explained is what it may be doing to your brain. Oxybutynin works by blocking acetylcholine, the same brain chemical disrupted by Benadryl. Acetylcholine is essential for memory and alertness. What makes this drug especially concerning is that it crosses into the brain more easily than many other medications, directly affecting the hippocampus, the region where new memories are formed. The long-term impact is significant. A 2019 study in the BMJ found that seniors who took strong bladder medications like oxybutynin for more than a year were nearly 50% more likely to develop dementia compared to those who didn't. Yet most patients are never warned about this risk. Instead, they may notice brain fog, forgetting appointments, or losing track of conversations, symptoms that are often dismissed as just aging, when in fact the medication could be playing a major role. The encouraging news is that alternatives exist. Newer options, such as mirabegron, mirbetriq, work through a different pathway and have shown much less impact on memory. These medicines don't block acetylcholine and are generally safer for older adults. If you or a loved one is taking oxybutynin and noticing changes in memory, don't ignore it. Talk with your doctor about safer alternatives, because bladder control should never come at the cost of your mind. Number 6. Statins. Statins are among the most commonly prescribed drugs in the world, especially for adults over 60. Medications like simvastatin, Zocor, and atorvastatin, Lipitor, are given to millions of people to lower cholesterol and reduce the risk of heart attacks and strokes. On the surface, they sound like an obvious benefit. But when it comes to the brain, the story is more complicated. Cholesterol isn't only about the heart, it's also vital for the brain. Nearly 60% of the brain is made of fat, and cholesterol plays a key role in protecting nerve fibers and helping brain cells send signals smoothly. When cholesterol is lowered too aggressively, the brain may lose some of the building blocks it needs to keep memory sharp. Research supports this concern. A 2023 study in Frontiers in Aging Neuroscience found that seniors over 70 who had taken statins for more than 3 years were more likely to experience mild memory problems, and those on higher doses often noticed greater declines. Some even described sudden lapses, forgetting names, recent conversations, or familiar places. It's important to note, however, that not all statins affect the brain in the same way. Drugs like pravastatin and rosuvastatin don't enter the brain as easily and may carry less cognitive risk. If you've been on statins for years and notice brain fog or confusion, it doesn't mean you need to stop right away. But it does mean you should talk with your doctor about adjusting your dose or considering a different option. The earlier these changes are addressed, the better your chances of protecting both your heart and your mind for the future. Number 5. Benzodiazepines. These medications include familiar names like lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax. They are often prescribed to help with anxiety, panic attacks, or trouble sleeping. At first, they can feel like a relief. They calm racing thoughts, reduce panic, and help with rest. But over time, the picture changes. Benzodiazepines work by boosting GABA, a natural chemical that quiets brain activity. While that may sound helpful, long-term use slows the brain in ways that can harm memory and clear thinking. A 2022 study in the BMJ followed more than 8,000 seniors and found that those who used benzodiazepines for more than 3 months had about a 50% higher risk of developing Alzheimer's disease. The risk was even greater with long-acting drugs like diazepam, which linger in the body and the brain. Many seniors on these medications describe feeling foggy, disconnected, or not themselves. And when they try to stop, withdrawal symptoms like anxiety, restlessness, and insomnia can make the drug feel necessary, even when it may be part of the problem. The safest approach is never to stop suddenly. If you've been on a benzodiazepine for more than a few weeks, talk to your doctor about tapering gradually. There are safer alternatives, such as buspirone for anxiety or cognitive behavioral therapy for insomnia. These options can restore calm without putting memory and independence at risk. Number 4. Amitriptyline, sold under the brand name Elavil. This is an older antidepressant that doctors still prescribe today, often for pain, insomnia, or even migraines. At first, it can look like a helpful all-in-one solution, but beneath the surface, amitriptyline is one of the strongest anticholinergic medications still in use. That means it blocks acetylcholine, the brain chemical that helps nerve cells communicate, store memories, and stay sharp. The effect is powerful enough that memory problems are not just possible. They are expected with long-term use. A large study published in JAMA Internal Medicine in 2015 followed more than 3,400 adults over 65. It found that seniors who took higher doses of anticholinergic medications like amitriptyline over 10 years were more than 50% more likely to develop dementia compared to those who didn't. What makes this concerning is that many patients were never warned. Often, they were given amitriptyline for sleep or nerve pain, only to notice subtle changes over time, forgetting short-term details, struggling to find words, or losing focus. These changes were often mistaken for just getting older, when in reality the medication was quietly adding to the problem. Even small nightly doses, taken over several years, can gradually wear down memory and attention. That's why it's important to know your options. For nerve pain, medications like duloxetine or gabapentin may provide relief with less impact on memory. For sleep, melatonin or very low-dose doxepin may be safer choices. And for mood support, newer antidepressants such as sertraline or escitalopram are generally considered more brain-friendly. If you or a loved one is on amitriptyline, talk with your doctor. Protecting your memory is just as important as treating your symptoms. Number 3. Paroxetine, better known as Paxil. Paroxetine is one of the most commonly prescribed antidepressants in the SSRI family, often given for depression or anxiety. On the surface, it looks like a modern, gentle option compared to older antidepressants. But there's a critical detail many people don't realize. Paroxetine is the only SSRI with strong anticholinergic effects. In other words, it interferes with acetylcholine, the brain chemical that supports memory, attention, and clear thinking. That makes it very different from its SSRI relatives, such as sertraline or escitalopram. In fact, a major review published in Frontiers in Psychiatry in 2021 found that seniors taking paroxetine showed declines in short-term memory, word recall, and focus within the first year. They were also about 30% more likely to develop early signs of cognitive impairment compared with those on other antidepressants. The difficult truth is that while paroxetine may help stabilize mood, it can gradually erode mental clarity and independence. For this reason, the American Geriatric Society has included paroxetine on its Beers criteria, a list of medications considered risky for older adults. If you or someone you love is currently taking paroxetine, talk with your doctor about switching to safer alternatives. Options like sertraline or escitalopram are usually better tolerated and do not carry the same memory risks. Supporting your brain with healthy levels of B vitamins, especially B12 and B6, can also help maintain mood and energy naturally. Protecting emotional health should never come at the expense of memory. Number 2, antipsychotics. This group of medications is especially concerning because many older adults don't even realize they are taking one. Drugs like quetiapine, known by the brand name Seroquel, risperidone, sold as Risperdal, and olanzapine, known as Zyprexa, were originally designed for serious psychiatric illnesses such as schizophrenia and bipolar disorder. However, over the past 2 decades, they have increasingly been prescribed to seniors for very different reasons. In nursing homes, hospitals, and even outpatient settings, these drugs are often used off-label to manage agitation, sleep problems, or behavioral changes related to dementia. Families are rarely told that what looks like a simple sleeping pill or calming medicine is actually a powerful antipsychotic. The risks are far from small. A 2022 study in the Lancet Healthy Longevity followed more than 25,000 seniors and found that those prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within just 1 year, even if they had no dementia at the start. On top of that, these drugs raise the risk of stroke, sudden death, and deep sedation. Sedation in turn increases the chance of falls, broken bones, and hospitalization. The way these medications work explains why the side effects are so concerning. Antipsychotics suppress dopamine, a chemical messenger in the brain that helps regulate mood, motivation, and clear thinking. When dopamine levels drop too low, the brain slows down. Seniors may appear unusually tired, emotionally flat, or not themselves. Families often describe it as though the person's personality is fading, when in fact, the drug is heavily blunting normal brain activity. Fortunately, there are alternatives. Before turning to an antipsychotic, many behavioral symptoms can be addressed without medication. Creating a structured daily routine, minimizing background noise, ensuring adequate lighting, treating untreated pain, or improving sleep hygiene can make a big difference. In cases where medication is absolutely necessary, experts recommend using the lowest effective dose for the shortest possible time to reduce harm. If you or a loved one is on an antipsychotic, it's important to ask the prescribing doctor why it was chosen and whether a safer option exists. Too often, these drugs are prescribed out of convenience, not true necessity. Knowing the risks allows you to make informed choices and protect not only brain health, but also the quality of life that every senior deserves. Number 1, anticholinergic polypharmacy. The most dangerous risk to brain health in seniors is not a single pill. It's the hidden effect of combining several medications that each block acetylcholine, the brain chemical needed for memory, alertness, and focus. This situation is called anticholinergic polypharmacy, and it's one of the most overlooked drivers of drug-induced dementia in older adults. Here's how it often happens. A senior may take diphenhydramine for sleep, oxybutynin for bladder issues, and amitriptyline for nerve pain. Each of these alone carries some risk for memory problems, but when taken together, their effects add up, creating a powerful cumulative burden on the brain. This isn't just theory. A 2022 study in Age and Aging tracked more than 280,000 older adults. Researchers found that those with the highest anticholinergic burden had more than double the risk, about 120% higher, of developing dementia within 10 years, compared to those with little or no burden. That's not a small increase. That's life-changing. The most concerning part is that many seniors don't realize they are even on anticholinergic medications. These drugs are prescribed for common conditions like allergies, sleep problems, pain, or bladder control, so their risks are easy to overlook. But when acetylcholine is blocked from multiple angles, the brain doesn't just slow down, it loses its ability to maintain healthy connections. Over time, this can look very much like Alzheimer's disease. The encouraging news is that this problem can often be fixed. The first step is a medication review. Bring your full list of prescriptions, over-the-counter drugs, and even supplements to your doctor or pharmacist. They can calculate your overall anticholinergic load and help you identify where changes are possible. Sometimes it's as simple as switching to a safer alternative, lowering a dose, or slowly tapering off unnecessary medications. Best of all, drug-induced dementia is sometimes reversible. Many seniors regain sharper memory, clearer focus, and more energy once the burden is lifted. The brain is remarkably resilient, if given the chance. That's why anticholinergic polypharmacy earns the #1 spot. It's not only dangerous, but also preventable. And prevention means protecting independence, clarity, and quality of life for years to come. You've now seen the 9 most concerning medications linked to rapid memory decline in seniors. Some of these drugs are necessary at times, but when taken for too long, at high doses, or in combination, they can quietly harm the very brain functions that keep you sharp and independent. The most important step is awareness. If you recognize any of these medications in your routine, don't stop on your own. Instead, bring this list to your doctor or pharmacist. Ask if safer options are available, if your dosage can be reduced, or if a different approach might work better. A simple review can make all the difference. The hopeful truth is that drug-induced dementia can often be prevented, and in some cases reversed. Many seniors regain clarity and energy once the burden is lifted. Share this video with someone you care about, and stay tuned for more trusted guidance on aging well. Your brain deserves protection today and for all the years ahead.